If I was a patient coming to see you, what might I expect by my office visit? What would happen during my office visit with you?
Well, the first thing is you want to take an accurate history. It's important that the patient explains what is the primary problem. So the history is vital. Following the history is a physical examination, where we will target our examination towards the problem. And then following that, if there are imaging studies, the imaging studies are discussed. And then from there, you hopefully can make a diagnosis. But if you don't have a diagnosis, then you need to at least make a treatment plan, or a plan that will hopefully lead to the diagnosis. Because when it's all said and done, you take the history, you do the physical, you order the test in order to make a diagnosis. Sometimes the diagnosis is crystal clear, sometimes it's not. But based on what you believe the diagnosis to be, then the patient really boils down to one of three things. You either leave it alone, depending upon the natural history of the problem left alone, or you treat it medically, pills, exercise therapy, or something along those lines. And always the last resort is surgical intervention. So you always want to go through the problem with the patient. They need to understand the diagnosis. They need to understand what their options are. In other words, doctor, what if I do nothing? What's the natural history of this problem if I do nothing? The second is, what can you do for me medically? And then the other and final issue is surgery, depending upon the risks and the benefits of that operation.